A surgeon drilled a hole in a living skull to save a life. That was long before modern medicine. Healers in the ancient world performed daring procedures. They rescued people from the brink. A Roman soldier survived a battlefield wound. A lost nose had something to do with ants. There were 15 medical practices from Antiquity. Myth met method to cheat fate. It shows a relentless will to heal. It tells you something about humanity itself. These are the forgotten origins of the medical miracles we rely on today. That first trepanation was a statement of hope. It happened in a world where the body and the spirit and the cosmos weren't separate things. They were all connected. So to understand why a healer would open a skull, you have to see the world as they saw it. Illness wasn't just a physical problem. A fever could be a god's anger. Paralysis might be a wandering spirit. Healing was a sacred art. It was a negotiation with unseen forces. In ancient Greece, that idea was embodied by Asclepius, the god of medicine. His temples were called Asclepians. They weren't just for worship. They were early medical centers. People would travel for days to get there. They'd go through a ritual called incubation. Sleeping in a special hall, hoping the god would visit in a dream to give a diagnosis or a cure. The priests there were the physicians. They interpreted the dreams. They gave treatments, herbal baths, changes in diet. A successful healing was recorded as a miracle, a direct act from a god. That mindset wasn't just Greek. In Mesopotamia and Egypt, the healer was often a priest, a scholar of ritual texts and the human body. To treat the body, you had to appease the spirit. That's why the Hippocratic Oath begins by swearing by Apollo and Asclepius. It bound the doctor to a moral code to help to do no harm under the eyes of the gods. So from our distance, trepanation looks like a frightening, risky surgery. But through their eyes, it was a meticulously prepared ritual. It was the physical act of removing bone. But it was also a spiritual act, releasing a trapped spirit, relieving pressure from an angry deity. It was a rational response within their universe. That fusion, myth, faith, observation, that's the essential backdrop. It turns these ancient procedures from curiosities into deliberate acts of salvation. And with that worldview in place, you can start to see the ingenuity of what came next. That first trepanation, that first time someone opened a skull and the patient lived, that logic didn't just appear. It wasn't a flash of genius. It came from watching, from learning slowly over a very long time. Ancient healers, they had their spiritual beliefs, of course. But they were also observers. They watched the world. They noticed things. They saw that an animal, when it was sick, would go and eat a certain plant. They saw how a broken bone, if you kept it still, would mend itself. Every injury, every wound from a fight or a field, every fever that broke after someone drank a certain tea, all of it was a piece of information. A data point in a vast, unrecorded experiment. This way of thinking, this empirical method, it found a voice in a man named Imhotep. In life, he was a vizier, an architect for a pharaoh, but his medical legacy was so deep that centuries later, people worshipped him as a god. His approach was methodical. He and the physicians who came after him, they started writing things down. Their scrolls weren't incantations, they were more like manuals. The most famous one, the Edwin Smith Papyrus, it reads with a clarity that feels modern. It lists 48 cases, trauma cases, head wounds, spinal injuries. For each one, it follows a formula: examination, diagnosis, prognosis, treatment. It even sorts injuries into 3 kinds: those you could treat, those you could contend with, and those you couldn't treat. This wasn't magic. This was medicine built on seeing patterns. Picture it, a healer in Thebes looks at a carpenter. The man has a deep gash on his arm. It's hot, swollen, oozing. The healer remembers a case from a scroll. Or a story his own teacher told. He recalls that a poultice honey and willow bark seemed to draw out the heat, helped the flesh knit, so he applies it. And he watches. If the carpenter gets better, that treatment goes into the healer's library, a proven remedy. If he doesn't get better, the healer notes that too. Maybe try something different next time. That was the engine, trial and error. It was brutally honest. The failures taught you as much as the successes. It slowly, painstakingly separated what worked from what people just wished would work. This principle, this act of observation, it turned everyday things into lifelines. They learned honey could keep a wound from festering. They found that moldy bread on an infection sometimes cleared it. They got good at setting bones using splints made of wood and linen. None of this was theory. This was knowledge forged in the urgent needs of suffering. It was the quiet work of paying attention to the world and to the human body's own capacity to endure, to heal, and from that bedrock, that foundation of practical knowledge, the most audacious surgeries could then be tried, with reason and with hope. Observation led to a conclusion. You could open the human body and the patient could survive. That's trepanation, drilling a hole into a living skull. It's the oldest surgical procedure we know. We've found it on ancient remains in Peru, in France, from Siberia to the Pacific Islands. This wasn't just some local ritual. It was a global idea, born from a need to understand a terrifying injury, a blow to the head, a hunter, a warrior, a heavy stone, a fall, a club. The person survives the hit. But then something changes. They get drowsy, speech slurs, one pupil widens, they fall into a deep, unnatural sleep. An ancient healer wouldn't have known the words. Intracranial pressure, hematoma, but they saw the pattern, the blow, the swelling, the fading away. They reasoned something was trapped inside, something pressing. And they had a tool, a sharpened flint or obsidian, later a bronze scraper. With a steady hand they would begin scraping, drilling, cutting a small window into the bone. The goal wasn't to enter the brain. It was to pierce the hard shell around it, to relieve that invisible pressure. The success rate, by some estimates, was surprisingly high. We know because we have the skulls. On many, you see smooth, healed edges around the hole. That means the person lived for years afterward. Their body recognized the opening and grew new bone to seal it. It's a silent testimony, a signature of survival etched in calcium, but the story has another layer. In that ancient worldview, illness had spiritual causes. The diagnosis was different. The same symptoms, seizures, blinding headaches, personality changes might be seen as an evil spirit trapped in the head. A demon rattling the cage of the skull. The treatment, though, was eerily similar. You open the cage, you create an escape route. So the same physical act served two purposes. It released fluid and pressure. In a medical sense and in a mythological sense, it released the tormenting spirit. One procedure addressing two realities. The tangible and the unseen. That's the duality of ancient medicine. A healer with a flint blade wasn't just a technician. He was an intermediary. His surgery was a bridge between the world of flesh and blood and the world of spirits. He operated on faith that the body could heal, and on the belief that the cosmos could be negotiated with. Trepanation stands as a monument to that fusion, an act of immense courage for the patient who had to endure it and for the healer who had to believe it could work. They looked at a fractured skull and saw not an end but a door, and they had the audacity to open it. Opening a skull took a steady hand and a quiet room. But medicine doesn't always get quiet. On a Roman battlefield, mud, screaming, chaos, there was no quiet. So healing had to become a system, fast, brutal, efficient, and from that, the Romans built something new, the first organized military medical corps. After a fight, special units called capsarii moved onto the field. Battlefield medics, they carried bandages, basic tools, Their job was to find the living among the still and get them back to a designated place, not a temple. A tent, a field hospital set up just behind the lines. This was where the medicus worked, the army doctor, and here he made a cold, calculated choice, one that still defines emergency medicine. He looked at the wounded and sorted them. This man, a deep leg slash, could be saved if they stopped the bleeding now. That one, a belly wound, they could only try to make comfortable. Another, a minor injury, could wait. They didn't call it triage, but that's what it was. A pragmatic system to save the most lives with limited time, limited resources. Their tools were made for the horrors they faced. The Volsella was a precise, cross-action forceps. Its job was to grasp an arrowhead or a spear tip and pull it out clean, minimizing damage. They had scalpels, bone saws, probes, but their real genius often came after. They knew a dirty wound meant fever, meant loss, so they cleaned injuries with acetum sour wine, vinegar, sometimes boiled water. A primitive antiseptic, but it worked. They used honey as a salve to prevent festering. They sutured wounds with thread, or they used ants. Yes, ants. They'd hold the edges of a cut together and let certain large ants bite across it, then twist off the body, leaving the pincers in place as living, organic stitches. This was medicine stripped of ceremony. It was about logistics, speed, what actually worked. The goal was two things: preserve the fighting strength of the legion and honor the duty to care for the soldier. It created a professional class of healers who saw more trauma in a year than a temple priest might see in a lifetime. They wrote down what they found, wrote manuals, passed on techniques. This system saved countless lives. It turned a soldier from something disposable into someone with a fighting chance to see home again. A cold, hard logic born in the noise of war. But it proved medicine could be systematized, scaled, deployed, and it asked a question: if you can organize healing for war, what could you build for peace? Rome's logic came from the battlefield. It was urgent, but if you're building something to last, medicine can't just be about the crisis. It has to be about what comes after. About getting a broken body back to a working life. And nobody thought more about permanence than the Egyptians. To them, a broken bone wasn't just an accident. It was a structural failure, an engineering problem, and they treated it with the same care they'd use on a pyramid. You see it in their scrolls, the Edwin Smith Papyrus, that trauma manual. It doesn't just list injuries. It gives steps. For a broken arm or leg, the healer is told to first put it in its place, to line up the broken ends. That act, reduction, that's the first step. Get the bone straight, then comes the real innovation, immobilization. They'd make splints from wood, palm bark, sometimes other sturdy reeds. They'd line them with soft linen to cushion the skin. Then bind the whole thing snug to the limb with cloth strips. It was a rigid shell, a primitive cast. This wasn't guessing. It came from watching how the body repairs itself. They saw that a bone held perfectly still would knit back together, but if it moved, the healing would be crooked, weak, useless. A leg bone misaligned could pierce the skin, lead to terrible hardship, so their splints were a kind of enforced patience. They were making the right conditions for the body's own miracle. Think about the context. This was a society of monumental construction, workers moving massive stones. Accidents happened, a falling weight, a slipped chisel, and a society needed its farmers, its soldiers, its scribes. Losing someone to a bad fracture was a loss to the community. So this knowledge was practical, deeply social. It was about keeping a person's place in the world. The papyri show an astonishing depth of observation. They describe spine injuries. They note how damage at certain vertebrae could mean losing feeling or control in the limbs below. They saw the spinal cord as a central cable of life. They knew when an injury was beyond fixing. They'd advise only rest and care. This was medicine with clear boundaries, born from honest appraisal. So when an Egyptian healer wrapped a broken limb in linen padded wood, he wasn't just setting a bone, he was architecting a recovery. He was using the principles of his civilization: stability, precision, foresight to guide the body back to wholeness. It was a quiet, daily kind of salvation. One that let a father walk again, a builder lift again, a life continue its course unbroken. This was healing not as a dramatic act, but as a faithful stewardship of the body's time and its innate will to mend. A broken bone, once it's set, still aches, a deep, throbbing pain, and surgery, that deliberate cutting into living flesh, is an agony. Beyond words, for medicine to advance, it had to solve a basic problem. How do you operate on someone who's awake, who feels every cut? The answer, for thousands of years, didn't come from a lab. It came from the soil, from the quiet chemistry of plants. Ancient healers became botanists. They learned to read the land for its hidden painkillers. They knew which root, prepared a certain way, could bring a deep sleep, which leaf, steeped, could turn sharp pain into a distant ache. This was the first pharmacy. It worked on observation. They saw animals avoiding certain berries. They noticed a tea from a particular bark made a person drowsy. They experimented, slowly blending these substances into formulas that created a window between consciousness and agony. In China, the surgeon Huo Chuo perfected a formula called mafesin. He mixed herb extracts into strong wine. The patient would drink it and become insensible. They wouldn't feel the scalpel or the bone sore. This let him perform impossible procedures, removing diseased tissue, even abdominal surgeries. Where before there was certain loss, now there was a chance. The exact recipe is lost, but the principle is clear. He found a way to separate the mind from the body's trauma, even if just for a little while. Across the world, in Greece and Rome, physicians developed a different method. They took sponges, soaked them in a brew from plants like mandrake, henbane, and the opium poppy. Before an operation, the sponge was held close to the patient's nose and mouth. The fumes were inhaled, pulling the person into a narcotic haze. It wasn't a clean unconsciousness, not like today. The doses were imprecise. The line between enough and too much was thin. Perilously thin, yet for a skilled healer, it provided those still moments to work, to amputate a gangrenous limb before the illness spread, to cut out a growth taking a life. Think of the courage that took on both sides. The patient placing absolute trust in the healer's knowledge of these dangerous plants. The healer knowing a miscalculation could mean a patient who never woke up. They were navigating a shadowy frontier between remedy and poison. The same flower that brought relief could also bring an end. This was high-stakes botany. Medicine wrestling with sensation itself, trying to grant temporary oblivion so life could continue. These herbal methods were imperfect, often terrifying. But they held a profound moral insight. They acknowledged that pain was a thing to be treated, that suffering wasn't a required part of healing. In dim rooms with steam rising from clay pots, our ancestors made a choice. They chose to challenge pain's absolute rule. They sought to grant the mercy of numbness, however clumsily. This quest to soften the hard edges of surgery born from the earth's own chemistry was a declaration. It said saving a life didn't have to be a torture. It could be an act of compassion, however imperfect. Numbness allowed for deeper surgeries, but some wounds weren't just wounds. Some losses marked a person for life. In ancient India, a physician named Sushruta faced a specific hardship, the loss of a nose. This was common. It could be a punishment or a result of conflict. To be without a nose was to carry a visible mark. It could mean being shut out from society, from your place in the world. It was a social crisis. A physical one. The nose was a gateway for illness. The face, incomplete, meant isolation. Sushruta, working around 600 BCE, saw this as a problem to solve. He recorded his solution in a text, the Sushruta Samhita. In its pages, he described a procedure. the reconstruction of a human nose, this wasn't vanity. It was restoration to give a person back their face and their place among others. The method was a pedicle flap graft. His instructions were precise. You would take a piece of skin still attached from the patient's own cheek or forehead. This kept the blood supply flowing. This flap was then rotated. Shaped, positioned over the remains of the nose, sutured into place, but the sutures were a marvel. They used live ants, large, strong-jawed ants. The surgeon would bring the edges of the graft together. Then encourage the ant to bite across the seam. Its pincers would clamp shut, holding the skin like a tiny staple. Then, the surgeon would twist the ant's body off, leaving the head and pincers in place, securing the wound. After days, when the graft had taken, these staples would be removed. The body would accept its own flesh. A new nose would begin to form, later sculpted by the knife. Think of the understanding here. They knew the body would reject foreign material, so they used the body itself. They knew tissue needed blood to live, so they left the flap attached. They needed to close a fragile, curved wound without crushing it with thick thread. So they used the perfect clamp nature provided. Each step answered a biological puzzle. This procedure was known as the Indian method. It traveled trade routes, astonishing physicians in Persia. Later in Europe, it became the foundation of modern reconstructive surgery. But more than a technique, it was an insight into healing. Sushruta looked at a person marked and broken by injury, socially unmade, and he asked how to make a person whole again, not just how to close a wound. How to rebuild identity. This was medicine for the deepest scars, the ones everyone sees, and the ones only the individual feels, a promise carved in living skin. That a life interrupted could begin again. A nose rebuilt could restore someone's place in the world. But then there was a different kind of injury, simpler, more brutal and far more urgent, a severed artery, a limb torn away. Here the problem wasn't identity, it was time. Life was leaving the body in a red rush. And the healer had minutes, maybe seconds, to make a decision. In that moment, all the herbal knowledge, all the spiritual insight, it meant nothing if you couldn't stop the flood. Greek and Roman physicians faced this. They faced it directly, and they developed a technique, startlingly direct, mechanically brilliant, and utterly life-saving. They learned to tie a knot. This was the ligature, a simple cord, linen or animal sinew, used to strangle a bleeding vessel closed. They didn't have our map of the circulatory system. They didn't know about arteries and veins as a connected loop. But they were superb observers. They saw that blood came from specific places in a wound. They noticed that pressure on a certain point could make the flow slow or stop. From this, they deduced a principle. If you could isolate the source, you could choke it off. The Roman encyclopedist Aulus Cornelius Celsus left clear instructions. In his work De Medicina, he describes the procedure for an amputation. The diseased or crushed limb is removed with a swift, clean cut. Then, before the patient is lost, the surgeon must act. He takes a needle, threaded with a strong ligature. He passes it under the pulsating, severed end of the major vessel. He pulls the thread through and ties it tight. One knot, then another. The flow ceases. The crisis is arrested. It's an act of stark, mechanical logic. Confronting a force of nature with a loop of thread. And think of the context. This wasn't done in a sterile theater. It happened in field hospitals. In homes after accidents, on stone tables lit by oil lamps, the healer's hands would be slick, the air thick with the metallic scent. Yet amidst that chaos, the procedure demanded a calm precision. Finding the right vessel among the trauma, tying it securely enough to hold, but not so tight as to tear the delicate tissue. It was a race against a fading pulse. The impact was profound. Before ligatures, a major amputation was almost always a final act. The surgery might be successful, but the patient would simply bleed out afterward. The ligature changed the equation. It turned the amputation from a death sentence into a survival story. It meant a soldier who lost a leg to infection from a minor wound might walk again on a crutch. A farmer who caught his arm in a mill wheel might live to see his family again, one-handed but alive. It addressed the primary, immediate cause of death in major surgery. Not the shock, not the later fever, the simple, catastrophic loss of blood. This technique represents a shift in thought, medicine moving from observation to direct physical intervention. From treating the illness to controlling the body's own desperate mechanics, the healer becomes an engineer of survival, using the simplest of tools. A length of string to perform one of medicine's most vital duties, to give time, to create a pause in the rush toward an end, so that the body's own profound resilience could have a chance to begin its work. It was a humble knot tied in desperation that held the line between life and oblivion. The knot held the blood back, but there was another kind of pain. Not a rushing pain, a gnawing one, a low, constant misery. It could grind a life down over years like a bad tooth. Even before sugar, tooth decay was a relentless problem. Coarse grains wore down the enamel. Infections got into cracked teeth that led to an abscess, a pocket of agony deep in the jaw, pressure building with no way out. This pain was more than discomfort. It was a slow poison. An infection in the tooth could tunnel into the jawbone, then into the bloodstream. What started as a local ache could become a fever. A fever that wouldn't break. It could turn into a systemic illness, one the body couldn't fight. In the ancient world, a toothache could kill you. Healers saw this. They understood the mouth was a gateway, so they went after the problem at its source. As far back as 9,000 years ago, in a Neolithic village, a healer would take a bow drill. A simple tool for making fire, but he'd fit it with a sharp point of flint. With a steady hand, he'd place the tip against a bad molar, and he'd start to turn it. The goal was precise: to drill through the hard enamel, to reach the soft, rotten pulp inside, to scrape it all out, to drain the infection. We know they did this. Archaeologists have found the skulls. The evidence is in the bone. A perfect, round hole drilled straight into a molar. The edges are smooth. That means the person lived a long time after the procedure. This was the most basic form of dentistry, a direct physical excavation of pain. Later, cultures refined it. The Etruscans, then the Romans, moved beyond just removal. They thought about restoration. If a tooth was lost, what then? They made solutions of surprising sophistication. A skilled artisan would take thin gold wire. He'd carefully bind a replacement tooth, often from an animal, sometimes from another person, to the healthy teeth on either side. That created a stable bridge. They also made crowns from gold, hammering the metal to fit over a damaged tooth. This wasn't for vanity. It was for function, for the ability to chew. To eat solid, nutritious food. In a time when every calorie mattered, losing that ability meant weakness, malnutrition, a slow decline. These interventions, from the flint drill to the gold bridge, were acts of deep pragmatism. They stopped a specific, debilitating agony, but more than that, they restored a critical biological function. They kept the gateway closed to a creeping illness. They gave people back the simple act of nourishing themselves. That early recognition that oral health was tied to whole body health was a quiet revolution. It proved that long before modern dentistry, our ancestors were already fighting to save lives. One precise, painful, necessary hole at a time. A toothache, you could drill that. But some pain, it didn't have a source like that. It was deeper, in the joints, a stomach that wouldn't settle, a tiredness that sleep didn't fix. For that kind of pain, the lingering kind, there was another system. An ancient one, and it worked differently. It didn't cut, it didn't drill, it used a needle, a very light touch. In China, a long time ago, 2,000 years, physicians had this idea. They called it qi. It was a vital energy. It flowed through everything alive, and health to them was just that flow, balanced, harmonious, illness happened when the flow got blocked. Or unbalanced, they mapped the body with these pathways, meridians like rivers of that life force connecting everything, the organs to the limbs, and the healer's job was to find where the river was dammed up, where it was stagnant or where it was rushing too fast, and to restore the current, a gentle one. Their tool was the acupuncture needle. They made them from bronze, later silver and gold. They weren't like surgical tools, they were slender, flexible. The idea wasn't to tear tissue, it was to guide, to insert at very precise points along those meridians. Points with names: Sea of Tranquility, Bubbling Spring. The goal wasn't injury, it was to send a signal, to redirect the energy that was stuck, to invite the body back into balance. Now, from a modern view, that framework, the energy channels, it's a metaphor, a beautiful one, a mythology of the body, but the effects were real. For many people, they were real. Ancient texts show it used for everything: arthritis, digestive problems, headaches that wouldn't stop, what we'd call anxiety now. It was a strategy for chronic things surgery couldn't fix. Take someone wasting away, some mysterious stomach problem. Surgery back then was often a death sentence. Herbs might not work, but a course of acupuncture, it might calm the spasms. It might bring back their appetite. It might let them keep food down, regain strength. That was its power. It managed the complications and the despair that comes with unending pain. That itself can be fatal. It saps the will to fight, to eat, to live. By offering some relief, by restoring a little function, acupuncture gave a foothold. It treated the person, not just the disease. It saw the physical pain and the emotional weight as part of the same problem, the same disrupted flow, and it was an alternative, a real one. In a world where your other options might be a dangerous sedative or a brutal surgery with low odds, here was this practice. Largely non-invasive, the risk of infection or serious injury was so low compared to the surgeon's knife. It represented a different courage, the patience to work with the body's own rhythms, to trust it could rebalance with just the gentlest nudge. This system came from Taoist philosophy. It was refined over centuries, and it shows something. That saving a life isn't always the dramatic intervention. Sometimes it's the quiet art of making suffering manageable, of turning that slow decline back toward daily life. Acupuncture was a gentle nudge, but sometimes in the ancient world you needed a map, a guide for the chaos of illness, a way to read the body's own signs. That map was drawn in Mesopotamia, the land between the rivers. There, the healer was often an ashapu, a priest, a scholar, an exorcist. He stood between two worlds, the world of angry spirits and the world of the physical body. His tool was a collection of clay tablets, the sakiku. The title just means symptoms. But in that simplicity was a revolution. The ashapu didn't just pray over a fever. He examined the patient methodically. He looked at skin color, the tone of voice, how they held themselves. He felt the abdomen, checking for hardness or tenderness. He inspected what the body expelled, the color of urine, the consistency of stool, even the smell. These weren't random notes, they were data. Each symptom was a piece of a puzzle. The tablets held the key. They listed hundreds of symptom combinations. And then a prognosis, a prediction. This illness lasts a month. This patient recovers. This patient dies. Think of that moment, the ashapu, after his exam, consulting the tablets. He wasn't guessing. He was comparing the living person to an archive of suffering, looking for a match, and when he found it, the tablets gave an answer. Not a cure, but a forecast, the likely course. This introduced medical judgment. It allowed for triage long before Rome. If the prognosis was death, the healer might shift away from aggressive treatments toward comfort, making the remaining time peaceful. It was a merciful withholding, a recognition of limits, but if the prognosis was recovery or slow improvement, then he could act. Apply his treatments with confidence. Herbal poultices, specific diets, rituals. The diagnosis gave him a target. This approach, linking observation to outcome, was a staggering leap. It turned medicine from a reactive art into a predictive science, still woven with invocations but a science. The Ashapu might believe a demon caused the fever. But he trusted the tablet to tell him what that fever meant. That's the heart of it. He used the mythology of his time to explain the why, but he used observation to understand the how. And the what next? This was medicine learning to listen to the cough, the tremor, the pallor, learning to see the body as a text, one that could be read. And in reading it, the healer gained the most crucial tool, the wisdom to know when to fight, and the greater wisdom to know when to bear witness and offer peace. That judgment born from clay tablets saved lives, not through dramatic intervention but through restraint. It taught healers to spend their hope where it could actually grow. That map of symptoms gave a healer foresight, but foresight couldn't stop a wound from festering. They needed something else, something to fight an enemy they couldn't see. And they found it, not in a temple, not in a scroll, in a hive, honey. It wasn't just a sweetener, it was a lifeline, a golden medicine, on shelves from Thebes to Athens. Egyptian papyri list it for burns, for ulcers, for deep cuts. Hippocrates prescribed it. It was a universal first aid kit, long before the concept existed. A farmer gashes his leg on a plow. A soldier takes a spear tipped to the arm. The immediate danger is the bleeding, but the true killer comes later. The wound grows hot. Red, angry, a fever sets in. This was the shadow, infection, and ancient healers, without knowing a thing about bacteria, had a weapon. They'd clean the wound with wine or clean water, then pack it thickly with honey, cover it with linen, and wait. What happened next was a quiet miracle. The honey, with its intense sweetness, acted like a sponge. It pulled moisture out of the wound, relentlessly. It created an environment where the organisms that cause festering couldn't survive. They were desiccated. Starved. At the same time, honey is naturally acidic, and certain types, when diluted, release tiny amounts of hydrogen peroxide, just enough to disrupt microbial growth. The honey also formed a barrier, a sterile seal over the flesh, keeping new contaminants out, letting the body's healing fluids work underneath. It was a natural antibiotic and an ideal dressing. All in one. Think of the practical genius. This wasn't a rare substance. It was available in most communities. It didn't require special preparation. It was stable, lasting for years, and its effects were visible. A wound dressed with honey healed cleanly, without the putrid smell, without the raging fever. It turned a gash that could mean a slow end into a manageable injury. A burn that could lead to crippling scarring could instead mend with less damage. This practice saved countless lives from the secondary ravages of injury. It was a collaboration with nature. The healer didn't need to understand the microbiology. He just needed to see that it worked. Generation after generation passed it down. When the skin is broken, apply the honey. It was one of humanity's first victories. In the invisible war for survival, a war fought with the golden gift of the bees. Honey fought infection, but there was another danger, a different kind. It was childbirth. In the ancient world, bringing a new life into it was the most dangerous thing a woman would ever do. It was a time of real vulnerability. A single complication could mean tragedy for the mother and the child. In that fragile space, the most critical healer wasn't a priest, it wasn't a surgeon. It was the midwife. Her knowledge wasn't written down in temple scrolls for men to study. It was passed in whispers, in demonstrations, from mother to daughter. From experienced hands to learning ones, it was a lineage, women caring for women, and it was a matter of survival. In Egypt, the Ebers Papyrus shows us some of this. It describes techniques for managing a difficult birth. It advises changing the mother's position, having her squat or kneel to use gravity. it mentions tools. Simple curved implements likely used to gently guide an infant's head during delivery. This wasn't guesswork, it was knowledge, refined over countless deliveries. A skilled midwife could recognize a breech presentation, a baby coming feet first. She knew specific maneuvers, careful maneuvers to turn the infant, or to deliver it safely in that position. Actions that could mean the difference between life and a heartbreaking outcome. Her toolkit went beyond the physical. She was a master of herbal lore. She knew which teas could encourage contractions if labor stalled, a dangerous situation. She knew which preparations could slow a delivery that was moving too fast. Giving the mother's body time, she provided constant care, massaging the mother's back, offering sips of water, speaking words of reassurance. That psychological comfort was itself a form of medicine. Reducing fear, reducing stress that could complicate everything. Her understanding of female anatomy, honed through hands-on experience, was often more practical than any surgeon's. She knew the rhythms of labor, the signs of distress. She knew when to wait and when to act. This specialized intervention reduced hardship for mother and infant. In an era without hospitals, without blood transfusions, her presence was the only safety net. She stood at the threshold of life, using all her accumulated wisdom to ensure a safe passage. Her success meant more than one birth. It meant the continuation of a family line, the strength of a community, the future of a people. She was the guardian of that moment. That fragile, powerful moment when a new person entered the world, and her skill turned a natural peril into a story of hope. Midwives guarded the threshold of life. But medicine itself, after Rome fell, faced a different danger, a darkness of forgetting. Libraries crumbled, scrolls turned to dust. All that knowledge, trepanation, ligatures, bone setting, herbs for pain, it could have vanished. 1,000 years of observation lost to silence, but the light didn't go out. It traveled east to a new constellation of scholars. During the Islamic Golden Age, from Persia across the Arabic world, physicians did something. They didn't just preserve the old medical texts, they built on them. They created a new foundation. Think of a great library constantly expanding. Teams of translators worked, rendering Hippocrates and Galen, Sushruta and the Roman Celsus into Arabic. It was a conscious rescue, saving the past from oblivion. Then came the next step, the critical one. They tested these ideas, they debated them, corrected errors. And they added volumes of their own discoveries. The pinnacle of this, in surgery, was a man named Al-Zahrawi. In the West, Abul Qasis, working in 10th century Andalusia, he compiled a 30-volume encyclopedia, Al-Tasrif. Its final volume was devoted entirely to surgery, and it changed everything. This wasn't a collection of scattered notes. It was a systematic, illustrated manual. Al-Zahrawi described with precision how to perform a cataract operation, using a hollow needle to depress the lens and restore sight. He detailed tonsil removal, explained how to set a dislocated shoulder, but perhaps his most lasting innovation was a material. For internal stitches where silk could fester, he introduced catgut, suture material from animal intestine that the body could absorb. This solved a problem that had plagued surgeons for millennia: how to close a deep wound without leaving a foreign object inside to cause infection. His encyclopedia didn't just list procedures, it illustrated over 200 instruments, forceps, scalpels, bone saws, specula, many of his own design. For the first time, a student could see the tools and read the step-by-step instructions. This standardized practice, it turned surgery from an arcane art, passed only from master to apprentice, into a teachable science. The work of Al-Zahrawi and his contemporaries formed a direct bridge, a bridge across the centuries of fragmentation in Europe. When the Renaissance dawned, scholars looked back to these Arabic texts, translated them into Latin, and found the very knowledge their own world had misplaced. The line from that ancient trep and skull to a modern operating room runs straight through the scriptoriums of Baghdad and the libraries of Cordoba. They were the guardians of the flame, ensuring the fragile, life-saving craft of the surgeon was not lost, but was polished, expanded, and handed forward. Ready for its next chapter, the guardians in Cordoba kept the craft alive, but they also inherited a question. How does the body work? Not just how to treat it, but the principles behind its health. For that, the West looked back to an earlier guardian, a Greek physician on the island of Kos, Hippocrates. His answer was elegant, it was comprehensive. And it was wrong in ways that would last for centuries, but inside that error was a seed of real progress. He proposed the theory of the four humors. He suggested imagining the body as a garden. Its health depended on a balance of four vital fluids: blood, phlegm, yellow bile, and black bile. Each humor was linked to things, to a season, an element, a temperament. Blood was spring, it was air, sanguine and cheerful. Phlegm was winter, water. Calm and sluggish, yellow bile was summer, fire, quick to anger. Black bile was autumn, earth, prone to melancholy. Illness was just a garden out of balance. Too much of one humor or not enough of another. This was a staggering leap. It took medicine out of one realm, away from capricious gods, away from vengeful spirits. A fever wasn't a demon, it was an excess of yellow bile, of fiery heat. A lethargic wasting wasn't a curse, it was a drowning in cold, watery phlegm. The cause was internal, it was natural, and so it was potentially manageable. The goal became restoration, to bring the garden back into harmony. That led to treatments. Treatments aimed at correcting the imbalance. If a patient was feverish, flushed, agitated, signs of too much blood and yellow bile, the physician might prescribe a cooling diet. Cucumbers, barley water. He might induce vomiting to purge the excess bile, or he might use the most famous treatment, the most controversial, bloodletting. From where we stand now, the idea seems counterproductive. To deliberately remove blood to treat illness, it seems harmful, and in countless cases it was. Used excessively on weakened patients, it caused great hardship, but inside the humoral framework for specific cases, it had a brutal logic. Take a patient suffering apoplexy. A sudden collapse, a loss of movement or speech, often a stroke. The ancient physician saw a person who was ruddy-faced, robust, maybe prone to anger. A plethoric individual, full of blood. The theory suggested this excess blood, this surfeit of the sanguine humor, had rushed to the head. It had caused the crisis. So the treatment was to relieve the pressure, to open a vein, often at the elbow, to let a measured amount of blood flow out. In a very specific set of circumstances, this could have a temporary effect. A mechanical effect, reducing blood volume can slightly lower blood pressure. For someone in a hypertensive crisis, that fleeting relief might have been enough. Enough to tip the balance, to let the body stabilize. This wasn't a cure, but it might have been, in those moments, a life-saving intervention, a desperate correction. A correction for a system in acute distress. The true legacy of the humors, though, wasn't in bloodletting. It was in the mindset it created. First, it made the physician a diagnostician. He had to observe carefully, is the patient hot or cold, dry or moist, excitable or despondent? These signs pointed to the dominant humor. Treatment was then tailored. Tailored to the individual's specific imbalance. This was personalized medicine, centuries before the term existed. Second, and most important, it established the body as a system. An integrated system. A problem in one part could affect the whole. Melancholy wasn't just a mood, it was an excess of black bile affecting the spleen. This holistic view encouraged physicians to look for causes, underlying causes, not just treat the surface symptoms. It was a structured model, a rational model. Flawed, yes, but it was a model. It provided a common language, a framework for debate, for learning. It moved healing away from pure magic into the realm of natural philosophy. For all its errors, the theory asked the right question. It asked how the pieces of the human puzzle fit together, and in asking, it set the stage for the next great reveal. The moment medicine would finally look inside the living system, and map its true, intricate pathways. The humoral theory looked at how the body's parts fit together. But one part, its failure was especially feared, the eye. To lose your sight was to lose the world. In the ancient world, a common cause was the cataract. That slow clouding of the lens inside the eye. It wasn't a film on the surface. It was a hardening, a milky opacity growing deep inside. Light couldn't pass through clearly anymore. The world faded to a blur, then to this pervasive, frustrating gloom. For a farmer, it meant the end of working the land. For a scribe, the end of reading. For anyone, it meant a life of increasing dependence, a slide into hardship. And yet, against that creeping darkness, ancient surgeons mounted this startling defense. A procedure of breathtaking delicacy. It was called couching, and it came from a simple observation. They realized the clouded lens wasn't part of the eye's living wall. It was a separate object, a small, hardened disc just suspended there, and if you could move it out of the way, light could enter the eye again. The technique was refined in ancient India, documented by Sushruta, later practiced in Greece and China. The surgeon's tool was a slender, sharpened needle, usually bronze or iron. The patient would be seated, head held steady. The surgeon approached from the side of the eye. With precise pressure, he'd pierce the white of the eye, the sclera, near the edge of the cornea. He had to avoid the iris, the pupil. He was working blind, guided only by feel and anatomical intuition. The needle would enter the interior chamber. Its tip would find the clouded lens, and then, with a gentle, persistent push, he'd dislodge it from its delicate ligaments. He'd nudge the opaque lens down and away, tumbling it into the lower part of the eye's vitreous humor, where it would settle out of the path of light. The procedure was over in moments. If it worked, the result was immediate, dramatic. Light could suddenly reach the retina again. Shapes, movement, faces, they rushed back into view. The vision wasn't crisp. The eye couldn't focus anymore with the lens gone. But the difference between total obscurity and being able to navigate your home, recognize a face, see the path ahead, that difference was monumental. It was the difference between a life ended and a life reclaimed. The risks were immense, of course. Any puncture of the eye invited infection, which in that era almost certainly meant losing the eye entirely, maybe facing a systemic illness. The procedure could trigger bleeding inside the eye, or it could lead to a later complication, glaucoma, a painful buildup of pressure. Yet for those living in that slow, gray twilight, the gamble was worth it. A skilled surgeon with steady hands and a deep knowledge of the eye's structure could tilt the odds toward light. This was surgery at its most intimate, its most audacious, an intervention on the very organ of perception. It required a faith not in spirits but in geometry, in the physics of light and the spatial map of the body. The couching needle was a tool of liberation. It didn't cure the cataract, it just relocated the obstacle, but in doing that, it restored a connection. A connection to the faces of family, to the colors of a market, to the horizon at dusk. It was a stark, mechanical solution to a deeply human crisis. A refusal to accept darkness as a final sentence. From a needle that could restore sight to a knot that held back a tide of red, each of these 15 acts was a defiance. A defiance of the inevitable, the trepanned skull, the reconstructed nose, the herbal haze before the knife. These weren't just procedures, they were declarations. Spoken in bone and sinew and plant resin, they said a life was worth a desperate gamble. worth a healer's steady hand and a patient's trust. For all the spiritual frameworks, the invocations to gods, the truth was human. It was a refusal to surrender, to pain, to disfigurement, to the shadow of an infection. These healers worked at the edge of the possible, with flint, with bronze, with thread and honey and observation. They had no germ theory, no imaging, no safe anesthesia. What they had was courage and a curiosity about the body's capacity to endure. To mend, their legacy isn't locked in the past. It's in every modern operating room. The principle of the ligature is in every clamp that controls bleeding. Sushruta's flap graft is the ancestor of today's reconstructive miracles. The Roman field medic's triage is the bedrock of every emergency department. The line is unbroken. We stand on the shoulders of those who looked at a broken body and saw not an end but a puzzle, a story that could continue. So as we reflect on these ancient arts, we can carry forward more than their techniques. We can carry their spirit, the spirit of inquiry that turned observation into insight, the compassion that sought to alleviate suffering, the resilience that looked at the limits of an era and asked, what if? Their story reminds us that the will to heal is one of humanity's oldest traits. It's a thread woven through our history, connecting that first surgeon with a sharpened stone to the teams of specialists today.